All right, so today we're talking about the ultimate back pain exercise. Somebody commented on the last couple of videos and they were talking about their back problem and decided that I was going to do this video tonight because I really think this one's the most important. Our goal is to give you the tools. We've been doing this for 23 years. There's a 90-step process. Today we're talking about one of the steps. It's the exercises. It's really about what to do when you have back pain. Now, typical spine looks like this. And I had back pain for 10 years. Serious back pain. And we got the video MRI, so we're going to talk about the MRI, but everything I talk about has a lot to do with the best way to treat the spine, but also my own experience. And I'm telling you right now, if you have back pain, you have to learn this technique. It's called abdominal bracing. And I'll tell you why you need to learn it. Typical spine looks like this. Head's here, hips here, 24 vertebrae. In between each vertebrae there is a disc. The disc allows for motion. The disc acts a little bit like a shock absorber. The disc is also a lot like a jelly donut. It's like a jelly donut in the sense that the center of the disc there is a jelly. Some of the major problems you can have when you have back pain are the bulging disc, degenerated disc, herniated disc, stenosis, spondylolisthesis, and those can all cause sciatica. But very often they're the result of a problem with the disc. Here's the disc, jelly donut. One vertebrae on top of the other with the jelly in between, okay? It's like a jelly donut. The outer portion of the disc, there's a thick material. The inner portion of the disc, there's a jelly. It's called the nucleus. What can happen when you have back pain is you could start to develop a little tear in the annulus. Sometimes it starts just in the beginning and maybe leads to a bulging disc. The further along it tears can lead to a herniated disc, and all the while the nucleus can dry out. And when that happens, it causes an inflammatory process. There can be inflammation where the tear is or inflammation in the end plate of the bone, but more often than not, the inflammation is here. And when you have inflammation here, simple activities makes it worse. Sometimes movement in any direction makes your pain worse. And when you have movement in any direction and it makes your pain worse, what you need is stability. You need to prevent that motion. And the way you prevent the motion is through the abdominal bracing. We'll show you what that looks like in a minute. But this is one of the exercises that if you learn one thing and you get this right, your life will get a little bit better. It doesn't necessarily magically fix a herniated disc or a bulging disc, but it creates stability. Why is that important? Because when you have this tear, it has to heal. And if you move around too much, if you're doing a lot of this and it hurts, you're aggravating the tear. And you're aggravating the area where the problem is. You're causing more inflammation. So the goal is you want to move less. I always tell my patients, when you have this kind of problem, it's also like having a cut, okay? This is a cut on a finger right over the knuckle. Matter of fact, I'm going to tell you something right now. Don't ever Google open wound. If you Google that, you'll be very disturbed, okay? There's a lot of pictures on there. Here, open wound on the knuckle. So what does that mean? Everybody's had a little paper cut or a cut sometimes. When you bend your finger, every time you bend it, you're going to open it. It's not going to heal the way it should, and the healing's going to take longer, or quite frankly, may never heal. Same thing with the disc. If you're doing this, it's not going to heal. That's why when you roll over at night, say, oh, I don't know what I did, now I can't get out of bed. Okay, you've aggravated this. You've aggravated this condition, or a variation of this condition, because it can be, you can have the bulging, you can have the degeneration, but they're all kind of the same. So what you want to do is you want to do the abdominal brace. You may have heard of it. There's two different versions of it. One's right, one's wrong. Again, we're trying to get the truth to you. How do we know the truth? We know the truth because we've been doing this for 23 years. Treated 30,000 patients. We know about back pain. That's what this video is about. That's what this channel is about. That's what our goal on Facebook is all about, to get the information to you. The goal is to prevent the motion. Okay? So, how do we do it? It's called abdominal bracing. Strengthens the muscles of your low back. Can't find my spine. Just broke the computer. Strengthens the muscles of the low back, but also starts to activate all these muscles. What you're trying to do is you're trying to brace this area right here. I'll tell you how to do it. It's not hard to do. Once you do it once, you can figure it out. You brace this area, and you have to be able to brace it with all your daily activities. Sometimes I tell the patients, look, start to brace and walk back and forth. So you start to strengthen the muscles of the low back, but when it is not activated, or you don't have the ability to brace, which is what happens when you have chronic back pain, you lose the ability to brace, your spine is unstable. And the unstable is that motion. Too much motion. It's unstable. Takes the pressure off the spine, and it puts your spine in better alignment. Now, this is what it looks like, okay? Kind of hard to figure it out. Spine's like this. What we're looking at is the back muscles, obviously, and then all the muscles that go around here. And what you want to do is you want to try to activate all those muscles at the same time. That is the brace. The brace gives your spine stability. You can do more when you're bracing, okay? And the way you do that, you know, one of the theories is you pull your belly button into your spine. That doesn't do it. The way you do it is, it's almost like someone's going to punch you in the stomach. And if I was to punch you or punch Cody in the stomach, because I want to punch Cody in the stomach, but when somebody's going to punch you in the stomach, I do Taekwondo, but when somebody punches you in the stomach, it's that activation of all the muscles. Okay, don't actually punch yourself, but that's the activation of your core, and that's the bracing. Okay, so you have to brace your core, but also those muscles at the bottom of your pelvis. Okay, and you have to contract those as well. So it's the whole core and then the pelvis. You want to activate those muscles. And the pelvis muscles are the muscles that you would contract if you want to cut off the flow of urine. Okay, so there's no better way to explain this than if you're going to the bathroom and you're peeing and you want to cut off the flow of the urine. That muscle you contract, that's your pelvic floor. Okay, so you want to try to contract all those muscles at the same time. It's not easy, but you have to train yourself. Okay, because that's actually normal. If you can't do it and you have back pain, it's because you've had the back pain. This is abdominal bracing. What does it mean? You gain better posture. You become a better deep breather, which is super important. We talked about the deep breathing. Also really good for your organs, stronger core and back. All the things that we talked about. So what I just told you is, like somebody's got whacky in the stomach, what it does is you want to contract all these muscles. It's like a ring. And that ring of muscles is what we call the bracing. When you have the ability to contract that, then you have more stability. We call it abdominal bracing. I want you to start by doing it while you're walking. Okay? Do it as you're walking. Focus on those muscles. Focus on the pelvic floor. Super important. And then what that does is it prevents this. Okay, what is this? That's an open wound getting aggravated. It's hard to say if it's the disc or the end plate or even the facet or arthritis, but there's an inflammatory process that's made worse by this. When you start to contract those muscles, that's when you start to gain some stability. It's the muscles of your core. It's the ring. Okay, it's not pulling your belly button into your spine. That activates the muscles. That's good, but you need them all. You need all of them, so you want to start by walking, but then all these exercises that we've talked about, you need to do them while you're doing it. Okay? The bird dog, the bridge, the dead bug, the lunge with the twist. All those things, you need to activate your core. You need bracing all the time. Okay? When you do these activities, this one especially, you're lifting up that leg and the spine is doing this. We talked about that. Spine can't rotate. Okay, that's going to aggravate it. Worst thing for this part of your disc right here is rotation. How do you prevent rotation? Abdominal bracing. That's how you do it. Probably every time we do a video, oh, this is the best, this is the greatest. This, quite frankly, is where you start. This is number one. Okay, just start by activating those muscles. Okay, and again, this is not a diagnosis. I'm not treating you. I'm not even giving you a treatment plan because I'm not your doctor. You're not my patient. This is a disclaimer. Okay, if you have a problem, it's not going away. You need to see a doctor. Okay, you can't prevent it. You can't pretend like everything's okay because you may have another problem, and you can have other problems. But abdominal bracing is good for everybody. It's absolutely the best place to start. There is no better place to start because you have to be able to control your spine. If you lose control of your spine, that's when you get this. It hurts, it hurts, it hurts, it hurts. It hurts when I walk, hurts when I sit. Okay, you need some stability. When you do your exercises, focus. Focus on your bracing, abdominal bracing. Again, if you got a disc problem, you're not getting better, you come see us. We can fix discs, degenerated, bulging, herniated, sciatica, stenosis. We have a study. The study proved that we're the best. Okay, I know it sounds silly, but the results for our treatment for chronic back pain was the best compared to all others. So, give us a call. Come see us if you still have problems. I want you to share this information. I want you to share all our information, but quite frankly, I think this is maybe the most important because everybody on the planet needs to learn how to do the bracing. Without bracing, you run the risk of never getting better, okay, because you keep aggravating it. I'm not saying you're never going to get better, but if you have a disc problem and you keep doing this to the disc problem, it's like that finger with the cut on it, never gets better. Okay? So share our information with your friends and family and co-workers. Like our Facebook page, because it's a good one. We do these videos every night, whether I want to or not. That's not true. And subscribe to our YouTube page, channel, I guess. And Instagram, follow us, and follow us on Twitter. All right? Was this a long one? Oh, wow, 15 minutes. This was a long one. But I don't know if there's any easy way to get through bracing. This is number one. If you're going to do anything, you start here. Start with this. This is absolutely where you start. So we should call this number one, right? All right. I hope that was helpful. I'm going to put another video over here for everybody that has access to more videos. I'm going to put it right here. These are good ones. And I'll see you tomorrow. And hopefully we get it done before too late because I know we have to run to another clinic tomorrow. It's going to be an all-day event, but I'm going to get a video to you guys tomorrow. Even if it's for 5 minutes, I'll show you the best way to lift things because I know we have to lift some patient files. All right, that's it. So I'm done. Have a good night and be safe and be careful.